Welcome back to Desk Careers. I am so excited to bring another incredible guest. Today we are welcoming Dr. Esther Zachariah, Pediatric Occupational Therapist, coming to us from Neuropedia, Children's Neuroscience Center here in Dubai in the United Arab Emirates. Welcome, Dr. Zachariah. How are you today?
I'm good. Thank you for having me.
I'm so excited to have you here and talk about your profession and the pathway that you took. I know that your journey is going to inspire many young people here at the college and young people all over our community. Let's start right at the beginning. One of the areas that I was most interested in learning about your career journey was the inspiration behind why you do what you do. Can you tell us a little bit about how you decided that being a pediatric occupational therapist and where that inspiration really came from?
That's a great question. So I grew up as a child of two doctors, and I always knew that I wanted to serve, in the medical community and serve patients and serve people in whatever way I could. I think they were my inspiration point to kind of point me in that direction. For the most part of, while I was graduating high school, I think I thought I wanted to be a doctor, but for some reason that didn't work out. And I think I happened to end up in occupational therapy school, which was my second option. But I think it worked out really, really well because it really fit my skill set, my personality, and it just brings out the best in me. I thought that that's what I would get being a doctor, but I'm so much more happier in this job. Why I became a pediatric occupational therapist and kind of become more specific is because of the kids themselves. I had this really amazing experience. So I studied in India, and then I had a really amazing experience for 2 years to kind of work in a rural part in India, which really shaped why I do what I do. And it really helped me kind of push me forward to kind of where my passion is right now, which is to work with kids on the autistic spectrum. So yeah, that's where I get my inspiration from.
Amazing. I want to take you back to your two inspiration foundations, both your parents being doctors. I know listening to this right now might be a young person feeling a little bit of pressure to become a doctor, maybe because they come from a family of doctors, or maybe it was the dream of a parent or a family member that somebody in the family become a doctor, and they kind of adopted that assumption that it should be them. What do you know now that you didn't know being younger and wanting to follow in the footsteps of your parents?
First of all, my parents, my father is a surgeon and my mom is a gynecologist. So in both their professions, it's quite, they don't know what's going to come next. You have all of these night calls, and you have what they like to call as a very unsteady work-life balance. They just really have to be there for their patients. And that's what they signed up for. But they somehow, my father particularly, did not want that for his girls. He said, you need to figure out what you need to do and find some place where you can be, you can get that sort of work satisfaction or job satisfaction and still be able to kind of give or have enough to give to your family when you're back home, which sometimes isn't the case when you're working as a doctor. So for me, I thought that this is what I wanted to do. Because that's what I saw. That's what, that was my everyday life. That's what I knew. But it was only when I went exploring to look at other options that my college offered that I found OT. It sounded really interesting. I know everybody knows about physio and what physios do, but OT was something that was really something that I connected to because I think my skill sets really fit in really well. And that when I made that connection, and I figured that out, it was really nice to take that step.
Tell me more about what a pediatric occupational therapist does. And I think you're right. Physiotherapy seems to be like the buzzword, it's the trend. Many young people come into the Careers Hub here at the college and they talk about wanting to be a physio. Very rarely do I hear somebody requesting more information about occupational therapy. So let's talk more about what does an occupational therapist do and why is it a career that you felt and still feel matches your skill set?
Um, okay, I use this a lot. I use this analogy a lot with parents and other people because, like you said, not many people know what occupational therapy really is about. So if you would think about a person who is, had an injury, let's say, and his hand is not functioning at an optimal level, and let's say his range of his elbow was probably full, and then because of an injury, just stopped here. So physios might kind of say, okay, let's build your strength and bring it up to here, but it's still not all the way to here. So OTs would come in and say, okay, this is what your skill level is at. Let's see what you can do. So imagine you can't brush your teeth if your hand is stuck here. You can't, let's say, button the top part of your shirt. You can't tie up your hair. You can't put like earrings on, or you can't put your headphones on, for example. So OTs might come up and say, okay, let's see how to creatively solve this problem. So we might come up with long handle reaches, just a long handle for your comb. Let's comb your hair. Instead of using a rubber band, let's use some sort of a clip that you can put on, or just maybe cut your hair short to make life easier. And that sort of strategies to come up with either building a skill or kind of saying, let's change the way you're doing things. So that's what OT brings into the context of a rehab team. So it's about function, it's about independence, it's about being socially appropriate.
Wow,
So,
I think I want to be an OT.
so
It also sounds like you need creativity as well.
exactly. So my love for biology and sort of creativity in general really fit in really well with this job.
Amazing. Now let's talk about how a young person could identify that, you know what, OT's for me. What is the skill set that you look for in aspiring OT therapists?
Um, so usually, I mean, for OT could be for anybody. If you have the patience, if you think you are creative, if you think, you like biology, you like kind of exploring the human body and trying to see how different solutions might work around the human body, then maybe OT is something you could explore to see if you like. Some people don't get it because it's too abstract. Uh, until you're actually in a session or you actually have a problem, it's only then you would think about an OT. If you want to strengthen your muscle, you want to, hit the gym, you think about a physio. But when you're thinking about, hey, I can't hold a pencil and write, I can't, let's say, count a couple of notes in my hand, I'm not able to think about, calculate in my mind what my change should be and make sure she's doing the right kind of billing or two things at the same time. That's when you think about an OT. Or that's when they would refer you to an OT. So if those are, some things that you would like to delve into or think about or you feel you're good at, that's something, you could do. Yeah.
Brilliant. Now, talk to me about the academic pathways that somebody would need to be open to if they want to become an occupational therapist. I know that you did a bachelor degree and a doctoral degree in occupational therapy. Is this the only pathway towards your career, or is there another way as well?
So I think each pathway differs from two different countries. I don't know if there are any OT colleges per se here in the UAE, but in India, you have a bachelor's degree that you would do. Then you could choose a specific kind of master's degree that you do. In the US, there's a separate system that's in place. You first become an OT assistant, then you become a registered OT assistant. Then you either take up a master's or a doctorate degree. Now, a doctorate degree could be a clinical-based degree, or it could be a research-based degree, based on what your goals are.
Wow. And you decided to go down the bachelor degree and then straight into a doctoral. What made you choose that pathway as opposed to the other one?
So I did my bachelor's degree in Christian Medical College in India. And then because my coursework was so extensive, they kind of took me on straight into a doctoral degree program at Boston University in the US. It was really nice that they allowed me to do that, because the way the program is designed is to have working professionals kind of upgrade themselves. And it was designed to kind of look at a work-life study balance, so to speak. So I decided to jump into a doctorate program because why do the master's degree and then get a doctorate if I can just go and do it straight away? It was a longer program for sure, because I needed to collect enough credits to graduate, but it was good. That I felt that was a good decision for me.
Amazing. I want to dive into some of the highlights of your career. You talked to me about volunteering in a wheelchair distribution camp in rural India. You talked about presenting your thesis at the conference. Not only presenting, you also won an award. And then you have started a social channel called Therapy with Esther. All very creative, all very different. How did you hone in on these extra outside of the box, different types of complementary things that are based on the foundation of your passion for being an occupational therapist, but then also going the extra mile?
It seems like I strategically planned this, but it really isn't. It just so happened to be that way. The wheelchair, we talk about a little bit of all of them so that we understand the different aspects of OT. So OT could just be for pediatricians, pediatric population. It could be for kids with like older adults. It could be for people with mental health illness. So OT could be across all of these different populations. So while I was trying to figure my way out, I happened to have these really good experiences. So the wheelchair distribution camp was a part of a widely known organization called Joni and Friends that has like a separate program called Wheels for the World, where wheelchairs are donated by people around the world. They are put together and then they are given freely to people who don't have access to a proper wheelchair. So there was a team that kind of supported the local therapists to kind of design or redesign or tailor make each wheelchair to each person that came in. It was almost like a camp. So people came in, they reassembled the wheelchair, and then they were out. And then we did this for about 3 or 4 days. I was part of that for about 2 years.
Amazing. That must have been one of the
It
most
was
empowering experiences of your life.
Yes, it was really, really nice. So, and then after that, the paper that I had done was on ergonomics. It's quite different. Ergonomics is basically looking at how your posture is when you're sitting. What are the kind of table and chair measurements that you would need to kind of prevent backache, neck pain, all of those things. And my research was about a particular modification to the table that was required at my college for all the cash workers, and kind of see how that would be an ideal solution to make that work. I was able to present it at the Indian OT conference that year, and it won the award for the best ergonomic paper for that year. And then the third experience was basically, it just so happened to pop up as a need for parents to just take their time to understand different concepts like sensory integration, what does it mean to have fine motor skills, all of those things, because in 1 hour when I'm bombarding them with information, at a session, they sometimes they're saying yes, but they're not able to kind of completely get it till they have their own time to kind of just sit back and understand. So this just came up as part of different problems that I faced throughout my career, and was just solutions that just rolled out.
I'm so inspired. You are a young woman. I'm looking at you and thinking, wow, any young person watching this right now is definitely going to be very inspired by not just what you do in your career, but also what you do when you're not in the office and helping patients. Let's talk about the three top tips that you've mentioned. Work-life balance is one of them. You also discussed how a school should fit one's goals and not the other way around. And then finally, finding ways to serve now. So I can see with therapy, your social channel therapy with Esther and the wheelchair distribution camp that you participated in, definitely ways to serve now. But how do you choose a school that fits your goals when everybody else is trying to choose a school that is well known and renowned and high on the ranking? How do you identify that my goals should come first and the university or the vocational training should complement what I am looking for?
Very interesting question, and I probably have lots to say, but I'll try to keep it short. When, for example, and I think I learned this in my own life, because initially I thought I wanted to be a doctor, right? But only after I went out to look for other options did I actually find OT, which fit me really well. But if I'm stuck on, this is what is expected of me, this is what I need to be doing, then I wouldn't have found OT. I wouldn't have had the job satisfaction that I have today. So, for example, if you're looking at, there are a lot of young kids I know who've not figured it out. They don't know what they want to do. But if you are able to kind of pinpoint some of the things that you're happy about, that makes you happy, that you kind of want to learn more about, or what is it that kind of gets you going, or even if it is like, some people are driven by passion, by what is it that kind of gives me that adrenaline rush in the morning. Some people are just driven by let's make ends meet. I need to have this much amount of money because I want to support my family. Both are completely fine, but kind of coming to a place to accept what your goal is will really help you kind of make that next step, to whether it is, you want to follow a passion which may or may not pay out, or actually follow something that pays really well. And then based on that, it can help you go to the next step. Coming back to kind of wanting to serve and serving now, in those experiences when you just volunteer and do stuff, you kind of will figure out, this is what I like and this is what I don't. But unless you go and put yourself out there to volunteer, you don't know. And to kind of and do that sort of experimenting by serving, you'll figure it out.
Such great advice. Thank you. Thank you so much, Dr. Zachariah. Where do you see yourself heading from here? I mean, you've already achieved such great things. Where do you go from here?
For now, some of my goals are to kind of, again, equip myself a little bit more to help the kids that I'm seeing. I'm trying to get a couple of certifications done so that I'm able to kind of help parents see how the brain works in an autistic child. Why is it that they're doing these different behaviors? How is it that they can help them? And I think other than that, I'm trying to see if, maybe at some point to kind of adapt everything that I'm learning, kind of make it easier for, again, people back in India, to kind of make it easier for them and to solve the problem of not enough OTs in rural areas. There are far more children than anybody could handle them who are not getting anything. So that kind of picks me up to kind of think about how I can solve that and how I can kind of equip myself so that I am either more available or train somebody else to be more available to kind of meet that need.
You're so inspiring. Thank you so much for being here with me today.
Yes, thank you for having me.
Such a pleasure. Thank you. And that brings us right to the end of another incredible career conversation. Today we were speaking with Dr. Esther Zachariah, who is a pediatric occupational therapist at Neuropedia Children's Neuroscience Center here in Dubai in the United Arab Emirates. I'll see you all at our next Desk Careers Digital Spotlight.